one of the things I've found more and more that I'm learning about as I practice more as well is that the place of pain is not often the source of the mechanical problem. So if you have hip pain, I'm going to look at the knees, the ankles, and the feet often to just see where the source of the problem is coming from. It may also be up the chain as well. So I'm looking not directly at the joint itself, but where along the continuum of the channels or the myofascial meridians, however you want to describe these pathways, these kinetic movement pathways that are governed by fascia, muscle, tendon, and ligament that move through the whole body, right? And that can lead in the hip up into your neck. Obviously, the spine affects pretty much almost everything. But figuring out then what also is going on with the patient as I'm moving their hip around. Is their head tilting slightly? Are they telling me also, man, I'm noticing this in my armpit or the opposite armpit? Or, so there's so much information that is being revealed through the palpation, the observation, as you're working with a patient or a client. And then the other part that I would say too, and movement-wise in particular, because I think giving patients exercises, giving people homework assignments is crucial to engage them in their own process versus a fix-it shop type of situation, right? Is being willing to ask the questions and hold space for the deeper emotional qualities and psychological patterns that likely led to the injury, right? Was it an acute injury? It just happened all of a sudden. Over time, I see more and more acute injuries still have some chronic or pattern behind them generally. And if it's a chronic situation, what is the underlying root cause that is having the person move in a particular way that's causing the pain, right? So palpation, observation, diagnosis, diagnostics, Eastern, Western awarenesses there, moving deeper into paying attention. Can we take our attention to draw out more clues or more information from the patient that may not just be physical or sensory, sensational clues, right? They actually have more to do with emotional responses or the ability for the patient to remember the state they were in when they felt the injury. Yeah, I was really angry about my husband in that moment and wishing he would have taken out the trash. Instead, I had to. And right in that moment, my hip went out and my back started hurting. That's important information because then you can acknowledge and see that the correlation to how we are experiencing emotions affects the different channels in our bodies, either in a moment or often it's over time, because I doubt the frustration about her husband not taking out the trash just wasn't that one time, right? And so we've got a pattern over time of frustration and anger that likely leads to a tension associated with the liver, which has to do with the inside and outside portion of the legs. And generally, you can begin to suss out movement patterns or movement dysfunctions from these emotional issues. And certainly then that leads to psychological patterns. And I guess in this moment I'll just explain that a little bit more. The Taoist way of perceiving reality from the unmanifest to the physical manifest reality is very important when it comes to any process of healing. The unmanifest, or the most yang, is a heavenly realm or spiritual aspect, right? It isn't yet even a thought. It's unmanifested, potentiated energy. Some just simply call that light. Right? But as that moves through the atmosphere and becomes more and more dense to then the earth realm, right? The earth being very physical or most dense, in between that heavenly realm and the earth realm, you have the mental energetic or the psychological, the emotional, and then the physical. And back in the classics, the Taoist classics, they talk about different levels of physicians. Right? The base physician treats physical symptoms, right? And basically can fix things like orthopedic conditions. But also structural or even internal, but that are structural or physical. The next level physician treats emotional and psychological. Right? We're moving up into more subtle realms of ways of perceiving what's going on for a patient. And then the superior or highest level doctor treats the Shen, or the spirit of the being. And that we could probably get into a little bit more as well. But this notion of the Shen, or the spirit, and then you have the field of Qi, and then as you get deeper, the more physical sometimes is referred to as the Jing level. So as a practitioner myself, over the years, I can look back and see how, 15 years ago, I was working a lot with the physical realm. And that included the fascia, right? It included the structural tissue. But more recently, I'm much more fascinated and recognize that I get much better results if I am working in these more subtle realms of a patient's experience.